C-SPAN's StudentCam video competition challenges high school and middle school students to produce a mini-documentary about compelling issues of the day. This year's winners crafted a video message to President Obama. Here's one of the second prize winners.
Here I am in front of Cleveland Clinic Hospital in Weston, Florida. Our new President-elect, Barack Obama, will be facing many issues that are vital to our country's future. In my opinion, health care is the most important issue. Currently, 47 million adults and 8.7 million children don't have health insurance. With the economy worsening every day, that number will certainly grow. The cost of health insurance is increasing by double digits for the working families. On the other hand, there are millions of Americans and their families that already have quality care that are mostly through their employers. The quality of health care in America is the best in the world. People oppose universal health care because they believe the quality of health care would decline. Clearly, health care will be one of the biggest issues facing Barack Obama and our national and state leaders in the coming years.
They urge universal coverage with all the tax increases, new mandates, and government regulation that come along with that idea. But in the end, this will accomplish one thing only. We will replace the inefficiency, irrationality, and uncontrolled costs of the current system with the inefficiency, irrationality, and uncontrolled costs of a government monopoly.
But I am so proud that I played a part in helping to create the Children's Health Insurance Program and to ensure 6 million children. And when I'm president, we're going to finish the job and provide quality, affordable health care for every single American man, woman, and child.
Congresswoman Debbie Wasserman Schultz from Florida's 20th Congressional District. Congresswoman Wasserman Schultz, do you think lack of affordable health care in America is a problem? If so, what should be done?
I do think that the lack of affordable health care is a problem, and it's one that I think we should solve in the very near future. We have 47 million Americans who do not have health insurance, which means when they're sick or when their children are sick, they can't afford to go to the doctor, and they have to make a decision between which bills they're going to pay, or just decide to put off their health care until they're so sick that they use the emergency room as their primary access point for health care, and then it's much, much more expensive.
What would you say to the people that need universal health care and have the quality of health care in America?
Well, I think there is a way to structure a universal health care plan so that we don't bring down the quality of health care. Critics of universal health care who use that as one of the reasons believe that if we start rationing health care, and that if you end up deciding who can get an MRI and who can get and who cannot, and decide which procedures are available, that could potentially reduce the quality. But what we want to make sure we do, at least what I think we should do, is we should use the private market.
How can universal health care be paid for and achieved for all Americans?
Well, that's the $64,000 question. I have filed legislation that would basically have it be revenue neutral, quite necessary, and string together some of the existing programs, but also covering private market and make sure that we don't balloon the deficit while trying to sanitize our health care for everyone.
Why do the health care prices continue to skyrocket?
Well, you have a very high utilization rate in the healthcare system. So I think we have a lot of people, a lot of doctors that are ordering tests, sometimes that are unnecessary. So you have overutilization of the system and a lot of payments that are made to physicians, maybe for health care that isn't quite necessary. And you also have the excess cost of covering the people who don't have health insurance now. Thank you very much, Robert. It's good to be with you.
Do you think there are any problems with the current healthcare system?
Yes, it's only available for really those that can afford it.
What do you think should be done about this?
I think more money needs to go into making healthcare, good healthcare, available to everyone.
What do you think about the current healthcare situation?
I think we're in a crisis.
And what do you think should be done about this crisis?
I think that those that can't afford it are entitled to have some sort of health coverage, but I also feel that those that want the ability to choose their own doctors and choose their own health care coverage should still be able to have that option as well.
What do you think about the current healthcare plan?
I believe the current healthcare system as it exists at this moment is in serious trouble. It's unaffordable for the average American, and insurance companies themselves are not communicating effectively with doctors as to what procedures and medications are required. And the red tape that one has to go through in order to get payment is sometimes so intense that people just give up. And it's just not working.
I'm here with State Senator Nan Rich from the Senate District of 34. State Senator Nan Rich, do you think that lack of affordable health care is a problem?
I think lack of health care for people in our state and across the nation is a very big problem.
What can be done to solve this national problem?
I would hope that he doesn't put health care on a back burner. I think that, while he's trying to solve the economic crisis, because I think, as I mentioned before, that it is all linked, and that so many people who have lost their jobs now don't have health care for themselves or their families.
What would you say to the people that believe universal health care would bring down the quality of health care in our nation?
Well, I would say, I guess my first thing would be to say that if you don't have health care at all, you don't have to worry about quality.
Healthcare has become a national crisis which needs to be handled with great care. To many, this solution comes in two starkly different alternatives. One, either maintain the status quo and stick with the current healthcare system that we have now, or two, move to a form of universal healthcare coverage of the sort now in place in Europe and Canada. It has been left up to the national and state governments, including President-elect Barack Obama, to make this vital decision. Change nothing, change everything, or compromise. A compromise between these two extremes must therefore be forged and a solution found that addresses the concerns voiced here.
You've just seen a winning entry from C-SPAN's StudentCam video competition. To view more winning entries and to see the complete list of winners, visit studentcam.org.